How to take aspirin for heart attack safely. Just imagine, you're at home on a quiet evening. The TV hums in the background. The smell of dinner still lingers in the kitchen. Suddenly, the loved one sitting right next to you freezes, clutching their chest, breathing in short gasps, cold sweat breaking out across their forehead. In that instant, your own heart seems to stop. Right there on the table, only an arm's reach away, sits the familiar bottle of aspirin. What would you do? Hand them a pill immediately? Call 911 first? Or hesitate, afraid of making the wrong move? Many people believe aspirin is nothing more than a common pain reliever. But in a life or death moment, a single aspirin can become the line between survival and loss. The problem is this: if taken at the wrong time, aspirin might not save and could even put the patient in greater danger. Have you ever thought that such a small action, lasting only a few seconds, could carry the weight of deciding an entire life? In this video, I'll show you exactly what aspirin does inside the body when a heart attack strikes. You'll understand why emergency doctors in the US often say, chew an aspirin. If taken at the right moment, it can keep you alive until the ambulance arrives. And even more importantly, you'll know clearly who should take it, who must never take it, and the exact golden window when aspirin truly works. So, does aspirin really dissolve a blood clot as many people believe, or does it quietly perform another task, less obvious but powerful enough to rescue a failing heart? Stay with me, because the answer in the next part will forever change the way you look at this little pill. 1. How does a heart attack happen? Have you ever wondered why a heart attack can strike so quickly that no one has time to react? To understand, picture the heart as a tireless pump, working day after day, pushing blood and oxygen to nourish every cell of the body. Blood flows through the arteries just like cars racing down a highway. As long as the road is clear, everything runs smoothly. But what happens if suddenly there's a massive accident blocking the middle of the highway? Traffic halts instantly. For the heart, that accident is a blood clot. A blood clot forms when there's damage inside a heart artery. Platelets, the body's natural road repair crew, rush in to seal the crack. Normally, this is a protective response, but during a heart attack, these platelets go into overdrive, sticking together and forming a dense blockage that shuts down blood flow. And when oxygen is cut off, heart muscle cells begin dying within just a few short minutes. Do you see how brutal that is? Only a few minutes are enough to leave the heart permanently scarred. The terrifying part is, you cannot see that clot with your eyes. You only feel it through vague symptoms. A crushing chest pain as if a heavy weight is pressing down, shortness of breath, breaking into a cold sweat, or even just unusual fatigue. How many people have mistaken these signs for nothing more than indigestion or work stress, only to ignore them until it was far too late? Have you ever seen yourself or someone you love in that very situation? According to the CDC, in the United States, every 40 seconds, someone has a heart attack. That means, right now, as you are listening to these words, dozens of people are struggling with the crushing sensation of their chest being squeezed. And most of them had no warning at all. What does this make you realize? That a heart attack doesn't only happen to someone else, it can strike anyone at the most unexpected moment. So what role does aspirin play in this critical scenario? Does it truly dissolve the clot that is already formed? Or does it merely slow down the death of heart cells? This is exactly where many people get it wrong. And the answer, which may surprise you, lies in the next part: how a tiny aspirin pill can buy extra time for a heart caught in a race against death. 2. How does aspirin work? When people hear aspirin, most think of it as just an ordinary pain reliever. But in the midst of a heart attack, aspirin becomes a silent hero with a completely different mission. The question is, what exactly does it do inside the body, and why can one small pill save a life? Let's return to the image of a blood clot blocking blood flow to the heart. At that moment, aspirin does not dissolve the clot. It isn't like a bulldozer coming to clear the road. Instead, aspirin prevents the repair crew, the platelets, from sticking together any further. Picture a crowd gathering, swelling bigger and tighter, pushing and shoving until the road is completely jammed. Aspirin acts like someone stepping in, telling the crowd to stop growing, so that at least a narrow path remains for blood to squeeze through. Its power lies in slowing things down. By stopping the clot from growing larger, aspirin buys time for the heart. Sometimes it's only 5 or 10 minutes, but in a race against death, every single minute is priceless. Did you know those extra minutes can decide whether the patient survives long enough for the ambulance to arrive? A landmark study, known as the ISIS-2 trial, published in The Lancet in 1988, proved this point. In that trial, tens of thousands of heart attack patients were treated with aspirin. The results showed a significant reduction in death rates among those who received aspirin early. Since then, aspirin has become a cornerstone of emergency heart treatment. You see, this isn't just theory. It's evidence grounded in hard medical data.
But here's a critical truth worth repeating. Aspirin does not dissolve the clot. This is where confusion often arises. Many people take aspirin expecting chest pain to vanish instantly. When the pain doesn't go away, they assume the drug isn't working. But in reality, aspirin is quietly doing its job, preventing the situation from getting worse, protecting what can still be protected, until medical teams arrive with stronger interventions. You may wonder, if aspirin only prevents the clot from growing, is it really reliable? The answer is yes, if you understand its true role. Think of aspirin like a life buoy tossed to someone drowning at sea. It doesn't pull them back to shore, but it keeps them afloat long enough for the rescue team to arrive. Do you think such a buoy is valuable when the life of someone you love depends on every passing minute? So, who actually needs aspirin during a heart attack? And on the other hand, who might be put in danger by taking it? This is the razor-thin line you must understand, because aspirin only saves lives when used on the right person at the right moment. And this will be made clear in the next part. When should you and should you not take aspirin? This is the decisive moment. Should you hand aspirin to someone clutching their chest in pain or not? The answer is not simple, because aspirin can be a lifesaver, but it can also be a double-edged sword. So how do you know when it should be used and when it must absolutely be avoided? First, remember an unbreakable rule. Always call 911 before taking aspirin. Why? Because some symptoms of a heart attack can be confused with a stroke caused by brain bleeding. And in that case, aspirin will worsen the bleeding inside the brain, potentially leading to death within minutes. Would you risk your loved one's life over a pill taken in haste? So when is aspirin considered safe for emergency use? Cardiologists recommend one simple principle. Only give aspirin if 3 conditions are met. First, the patient shows clear symptoms strongly suggesting a heart attack. That means chest pain that feels like a heavy weight pressing down, shortness of breath, cold sweats, and pain spreading to the left arm, shoulder, jaw, or back. In women and older adults, symptoms can be more vague: nausea, unusual fatigue, or dizziness. Have you ever seen someone think it was just stomach pain, only to later find out it was a heart attack? Second, 911 has already been called. This is the top priority. Aspirin only makes sense if you are certain that emergency medical help is on the way. Never let aspirin become the excuse to delay calling for help. Third, the patient has no contraindications. That means they are not allergic to aspirin, have no history of severe stomach ulcers, are not actively bleeding, and are not taking strong blood thinners. These are critical details because if even one is present, aspirin can turn from a savior into a serious threat.
A major meta-analysis published in 2011 by Raju and colleagues in PubMed looked at thousands of patients. The results showed that while aspirin can lower the risk of heart attacks and ischemic strokes, it also significantly increases the risk of major bleeding and stomach hemorrhage. This underscores one fact. Aspirin is not a miracle drug for everyone. It is only truly beneficial when used at the right time for the right patient. Now put yourself in this situation. Your father, age 70, is struck with severe chest pain. You know there's aspirin in the cabinet. What do? If you've called 911, confirmed he's not allergic, has no history of severe stomach ulcers, and is still alert enough to chew the pill, then aspirin at that moment could be the lifeline. But if you're unsure, if the symptoms are vague, or if he's on anticoagulants, giving aspirin in a rush could make the situation twice as dangerous. In other words, aspirin is a double-edged sword. It can save lives, but it can also cause harm. The key is knowing when it stands on your side and when it works against you. Do you realize that even a simple checklist taped right onto the refrigerator door could help your entire family make the right decision in that stressful, critical moment? So once you're certain aspirin is needed, the next question is, what dose should be given and how should it be taken to work as quickly as possible? This is the secret many people get wrong in real life, and it's exactly what we'll uncover in the next part. 4. How to use aspirin safely in an emergency. When you're certain the person in front of you is having a heart attack and you've already called 911, that's when aspirin becomes a life-saving tool. But did you know it's not enough to simply swallow a pill? The way you take it determines whether aspirin can truly race against time. In emergencies, the commonly recommended dose is 1 full-strength 325 mg aspirin or 4 low-dose baby aspirins of 81 mg each. But the most important detail is not the number, it's how the medicine is taken. The patient needs to chew the aspirin, not swallow it whole. Why? Because when chewed, aspirin is absorbed quickly through the lining of the mouth and enters the bloodstream within minutes. If swallowed, it has to pass through the stomach and liver first, wasting precious minutes the heart doesn't have. You may have heard of enteric-coated aspirin, the kind with a protective coating meant to reduce stomach irritation. That type is completely unsuitable in an emergency. Studies on more than 10,000 patients show that coated aspirin doesn't actually reduce the risk of stomach bleeding as much as people believe, but it does slow absorption significantly. And in a race against death, even a few minutes of delay can be the difference between recovery and permanent damage.
Another detail many overlook: aspirin is only the first step. It is not a replacement for emergency medical care. It's like throwing a life buoy to someone drowning in the ocean. It keeps them afloat until the rescue team arrives. But if you think aspirin alone is enough and you don't call for help, you're placing a life in grave danger. So how can you make sure your family reacts quickly and correctly in that golden moment? Some American families have found a very smart way. They've made aspirin part of their at-home emergency plan. Would you like to know how they prepare themselves to save a loved one's life with just a few simple steps? 5. Real-life story: how one family prepared. Some stories seem small, yet they can mean the difference between life and death. In a quiet town in Michigan, 67-year-old Mrs. Thompson once witnessed her neighbor rush to the hospital with a heart attack. The family panicked, not knowing what to do, and by the time the ambulance arrived, it was too late. That experience weighed heavily on her. One evening, she took out a pen and paper, typed up a simple checklist: call 911 immediately, check for allergies, chew 1 aspirin 325 milligrams. She taped it to the refrigerator door and placed a bottle of aspirin right next to the landline phone. Then she called her husband and son together and rehearsed a mock scenario. "If Dad has chest pain, what do you do first?" she asked. One by one they practiced: call 911, hand over the aspirin, remind him to chew it, then wait for the ambulance. Just 15 minutes of practice, and she said, "I felt so much calmer because now everyone knows what to do instead of freezing in shock." Don't you see how such a small action turned the whole family into a mini emergency response team? The second story comes from Ohio. Richard, 68, once attended a community training session on heart attack first aid. At first, his son thought the class was unnecessary, but just 3 weeks later, one morning, Richard suddenly suffered intense chest pain, rapid breathing, and cold sweats. Thanks to what she remembered from that training, his wife immediately called 911, gave him an aspirin to chew, and kept him calm until the ambulance arrived. Doctors later confirmed that this quick response prevented his heart from sustaining severe, lasting damage. His son admitted afterwards, "If we hadn't been prepared that day, my father might not be here now." You see, no one wants to imagine the worst-case scenario, but preparation is the only way to turn panic into the right action. The question is, does your family already have a simple plan like that?
And even more importantly, what would happen if right now you also printed out a checklist and placed a bottle of aspirin in the most visible spot at home? Let me explain why something so simple could change an entire life in the conclusion just ahead. Do you remember the bottle of aspirin in the medicine cabinet I mentioned at the very beginning? Back then, it was just a familiar detail, but now you know the truth. It can become a life buoy in the middle of a heart attack if used correctly for the right person at the right time. And yet, it can just as easily become a deadly danger if taken recklessly without understanding. The most important thing to remember is this: aspirin does not replace an ambulance. It is only a temporary measure, buying the heart a few golden minutes while medical professionals are on their way. One aspirin cannot stop a heart attack, but it can slow the death of heart cells, giving you the chance to survive and recover. Do you see how powerful a small action lasting just a few seconds can really be? Look back at the stories you just heard. Mrs. Thompson prepared a simple checklist and felt reassured because her whole family knew what to do. Richard survived because his wife remembered to call 911 first, then have him chew aspirin. These stories aren't just anecdotes. They are proof that anyone can become the hero of their own family through timely preparation. So I want you to ask yourself, as of today, do you have aspirin placed somewhere easy to reach? Have you taped a small instruction sheet to the fridge or beside the phone? And most importantly, have you shared with your loved ones how to use aspirin safely when a heart attack is suspected? If you found this information useful, leave a comment below, because your story could save someone else. Share this video with your parents, your friends, anyone over 60 whom you care about, because one aspirin, one timely decision, might be the very thing that keeps the person you love alive. Wishing you health, peace, and the confidence to know exactly what to do when that life or death moment arrives.